This is an elderly patient, as you see, with quite significant scoliosis, severe degenerative disc disease, and as you see here, we have L1-S1 scoliosis. The measurement when patient is laying down is about 37 to 40, but when patient stands up, it's significantly worse. But I think more important than the scoliosis is the torsion of the vertebral body. As you see, there's significant torsion of the vertebral body in the lower region to the left. And when we go higher up, here even patient turns a little to the other side. This present more challenge than the scoliosis itself even. The surgery was 1 week ago, and the surgery went actually well, but it was technically difficult because of the torsion. This patient is elderly, bone was soft, but we could still correct most of the scoliosis. Patient is going to be discharged today, so 1 week after the surgery. Usually patients stay actually much shorter, but this patient has some confusion with the pain medication, so that's why it's staying longer. This is post-operative result. As you see, in the area of the surgery, most of the scoliosis is corrected, and now we are going to go one by one. The screws in the L1 coming right here. There are practically screws are same size or even a little larger than the pedicle, but because of the pedicle have some elasticity to that, we could put actually 6-5 screws in the L1. Then, as you see, the L2 screws are as well very well positioned. All screws are stimulated up to 25 to 30 milliamp. And here you see that L3 screws. One of the screws was at very oblique angle because of the overall anatomy. This was best we could do, even though it look in this picture that we are traversing. It's very minimal opening. You see just only in 1.5 cut you see the screw traversing here, even though here in the axial it looked like there is more to it. But in truth, it's just barely skiffing the pedicle. So this is a good positioning, and we stimulated the screws that did not show any stimulation below 20 milliamp. Then the L4 screws, as you see here, as well positioned, and L5 screws and S1 screws. I always aim for bicortical S1 screws, and as you see here, the alignment is pretty good. You see most of the vertebral body in one cut, and in the sagittal view as well you see that practically most of the scoliosis is corrected. Again, this patient had some confusion, so longer hospital stay. Our blood loss was practically about 200 cc, 220 cc actually, where we measured the sponges before and after. So again, this after the surgery and this before the surgery, where you see the most of the scoliosis is corrected.